Hands down, the most effective treatment is replacing what is missing and what is causing the brain to make hot flashes. And that's estrogen, like it is being produced in the ovaries. Hello, welcome back. Today we're going to talk about hot flashes, what they are, what causes them, and what you can do about them. And just to make it clear, we're only going to be talking about hot flashes in women. Gyno info is not interested in hot flashes in men, even though men can have hot flashes. Hot flashes are sometimes also called hot flushes because you flush your face when they happen. And doctors use the term vasomotor symptoms. Vaso stands for blood vessels, because vaso are vessels, and motor for the effect of muscles and nerves on those vessels, hence vasomotor symptoms. But we just call them hot flashes. So they're a sudden feeling of heat that ranges from mild to feeling on fire. Mild would be hot but not yet sweating. Moderate would be very hot and sweating but not overwhelming. You can still keep doing what you're doing. And severe is that you're so hot and so sweaty that you have to stop everything, change your shirt, change your nightshirt, open the window, do all sorts of things to somehow cool down. But interestingly, if you measure the temperature of the inside of the body, even though it feels like you're on fire, they're actually a fraction of a degree that is really changing. The temperature that increases, you just feel like it's increasing. And some women also have palpitations with the hot flashes, and sometimes that's their main symptoms. Palpitations is like pounding or rapid beating of your heart. Some women even have dizzy spells, and some women have chills, cold flashes rather than hot flashes, especially if they had a mild hot flash and then they feel chilled afterwards. And as I said, the hot flashes are caused by a screwed up temperature center or thermostat in your brain. Normally, you have a comfortable zone that is kind of a band. It's between, let's say, 68 and 72. But instead of a band with a comfort zone, you have a line. And you can never sit right exactly on the line. You're either too cold or too hot. Now, there's some people who have a different comfort zone where they feel comfortable. Like my kids, when they were young and I questioned their choice of shorts in the winter, they would say, well, Mom, we just have a different thermostat than you do. We are perfectly warm. And so that happens. But even those women who have a different thermostat in their pre-menopause and pre-hot flash life, they will have now aligned. The line may just be a little bit lower and they're feeling even more hot. And it's the lack of estrogen when the ovaries stop producing estrogen that makes this thermostat super sensitive and turns it from a band of comfort to a line where you never can be comfortable. So in response to a hot flash, the brain, of course, tries to cool the body down. And one of the things it does, it dilates the blood vessels. It makes the blood vessels wider under the skin so the heat can radiate off. That leads then to this flushing. It also activates the sweat glands. And so you start sweating. And if it's happening at night, they're called night sweats and they screw up your sleep pattern. And when the brain overshoots this correction, that's when you're going to end up with cold flashes. And as I already mentioned, the screw up of the thermostat is most often related to menopause, the midlife changes of the hormone production of your ovaries. There are also some illnesses that can cause hot flashes, but we're not going to talk about them right now. And the brain's reaction is to changing in estrogen levels, not to a specific estrogen level. You can't just measure and say, at this level of estrogen, you'll have hot flashes, at this, you don't. It's a change from here to there that's going to cause the brain to react in the way we have just described. Estrogen is a hormone that's produced by the ovaries in the process of making eggs. As women get older, the eggs and estrogen production becomes a little bit less reliable until it completely stops with menopause, and that's generally somewhere between 45 and 56. But the symptoms of changing hormone levels when the ovaries get less reliable before they stop altogether can already start before 40. And that's then called perimenopause, which we'll talk about in another episode. About 75 to 80% of menopausal women in the US have hot flashes at some point. Some have them for a few months, some have them for many years. The average duration is about 7.5 years, but many continue having hot flashes into their 60s and 70s. I have patients who have hot flashes when in their 80s even, but those are generally related to trying to stop their estrogen replacement, because one of the hot flash treatment, of course, is estrogen. The earlier you start with having hot flashes, the longer they will last. That's really not fair, but it's a fact. Black women tend to have more hot flashes than Caucasian women, and both of them have more and more severe hot flashes than Asian women. Asian women have other specific symptoms of menopause and changing estrogen levels. Other risk factors for hot flashes are smoking, being overweight, not moving much, and also being poor and having problems making ends meet. But that is probably hard to separate from stress, which can also trigger hot flashes. If you can't make ends meet, then you have no money. That's pretty stressful. So no wonder you have hot flashes. But it's been studied in a study of menopause in women across the nation, the so-called SWAN study. And there are even genetic variations that predispose to hot flashes. Once again, you can blame your parents. So what can you do about hot flashes? Treatment options can basically divide it into three main categories, three main things. There are the so-called lifestyle modifications, like losing weight, exercising more, not smoking and avoiding alcohol, avoiding hot flash triggers, which I'm going to be listing in a moment. And then you can do meditation, yoga, mindfulness training, and other psychological measures and psychotherapies that are recommended, but mainly they reduce the stress and they make you care less about the hot flashes. You get more mellow about it and less upset. But reducing stress also reduces hot flashes. And then there are the over-the-counter products that your pharmacist will try to sell you, and we'll talk about those in a minute. And then there are prescription medications. Some of them are hormones, and some of them are brain-modifying medications, like antidepressants. Some of them are also good for hot flashes. Hands down, the most effective treatment is replacing what is missing and what is causing the brain to make hot flashes. And that's estrogen, like it is being produced in the ovaries. Luckily, nowadays, identical human hormones, like those that the ovary produces, are available by prescription in the form of pills, sprays, patches, or gels. The marketing buzzword for all those products is called bioidentical. Identical means exactly the same. Bio is just sort of a word thrown in because it sounds good, but bioidentical or species identical hormones, because you're not a horse. We used to use horse hormones. You're not a red clover and you're not a soybean, but you're a human female. And so they're identical to the human female species. So these bioidentical hormones are available now, and they can be given for the treatment of hot flashes and are hands down the best method. We will talk about the ins and outs of menopausal hormone treatment at another time. This is just a general overview of what can be done about hot flashes. For women who, for medical reasons, cannot take those natural hormones, there are other prescription drugs to effectively treat hot flashes. Again, something we'll talk in more detail in another episode. And then to the so-called lifestyle modification belong the avoiding of triggers that cause hot flashes, like spicy food, alcohol, caffeine, smoking, hot weather, can't do much, but you can maybe stay in an air-conditioned room. Hot beverages, if you're tending to have hot flashes and feeling hot surges, you certainly don't want to drink a cup of hot coffee because that will definitely trigger it. Hot showers and baths, heavy clothing can produce them as well. So it's recommended that you dress in layers that you can shed, sort of like the onion principle of clothing. Avoiding being overheated from work or exercise helps. And of course, reducing stress and anxiety. All the over-the-counter non-prescription herbal remedies, they're not really much better than a placebo, sugar pills, in so-called double-blind studies. A double-blind study is where neither the patient nor the doctors knows whether a sugar pill, a placebo, or the real plant remedy is being used. Of course, in some women, hot flashes will go away spontaneously. As I said, they last not in everybody many years. Of course, in some women, hot flashes will go away spontaneously in a few weeks or months. Not everybody has hot flashes for years. And the over-the-counter herbal medications generally say it takes a few weeks for them to work. So they will then get the credit for treating hot flashes that went away on their own and would have gone away with a sugar pill, which is what the placebo effect has shown. But it is really interesting how the placebo effect works in the brain. If I give you a pill and say, this pill is going to treat your headache, or this pill is going to treat your hot flash, and you believe I'm a good doctor and I'm doing something and you are doing something, you're taking a pill, you're going to feel better. Even if this pill was not an aspirin, but a sugar pill, your headache will get better. One interesting study was with medical students. They gave them in a dentist chair, they gave them shots of salt water instead of lidocaine, a painkiller. And they all had less pain when the drill was used, just because their brain expected that this shot that hurt was going to make them hurt less with the drilling. So that's why the placebo effect is very strong. Unfortunately, it's not usually lasting past 2 or 3 months. But in 2 or 3 months, your hot flashes might have gone away spontaneously. And so you may think it was those herbs you took and you keep taking them. But the bottom line is that the herbal products that you can get over the counter, other than the ones that contain valerian, which helps you sleep better, are probably a waste of your money. So here are the take-home messages on hot flashes. There's absolutely no benefit of suffering them as long as you have no contraindication for the only real effective treatment, which is bioidentical, real human ovarian hormones. You should take them and feel better. And also remember, hot flashes are just the lead symptom for a whole bunch of other things that start with the perimenopause, the time when your ovaries start getting a little flaky. And those symptoms are brain fog, problems thinking and concentrating and remembering, joint aches, insomnia, and many others that we'll be talking about in one of the next episodes on Gyno Info about the perimenopause. If you have any questions before that next episode about hot flashes or anything else you'd like to ask that has to do with gynecological health, you can write to us at questions@gynoinfo.net. And hope you will tell your friends about us, put some likes on, and tune in next week and learn something else. Thank you. This is today's life tip. Here is today's boyfriend test. Try to imagine sitting together at Sunday breakfast 10 years from now. Will he still have anything to say that interests you? Could he still make you smile or giggle? If the answer is no, you're probably wasting your time with him, unless you just are after a short time fling anyway. I think it's a very good test to figure out if a relationship has long-term potential. Because in the long run, whether a guy is boring is probably much more important than how big his muscles are. Until next time, thank you for listening, and remember that you and your health are super important and deserve your full attention. Don't ever put off contacting your doctor because you're scared or embarrassed when something feels wrong about your body. Doctors are here to help you and not to judge you. And also, regular well-woman visits are always a good idea that you should make time for. You deserve it, and you owe it to yourself, and you owe it to your body and your health. This podcast is part of Pride House Media, hosted by me, Dr. Burki, produced and edited by Josh Rosenzweig. Original music composed by Nell Balaban. If you enjoyed this episode, please subscribe wherever you listen to podcasts. And while you're there, leave us a rating and a review. It really helps others discover the show. Stay connected and join the conversation by following me on Instagram and Facebook at Gyno Info and on LinkedIn at Gyno Info Podcast. Remember, any questions that I answer or information that I give you on this podcast are to be understood as information only, not treatment of your medical problems. While I'm a very knowledgeable gynecologist, I'm not your gynecologist who has talked to you and examined you personally and is therefore actually able to treat you. So please consult your own healthcare professional with any medical questions or concerns.